I'm Dr. Leo Krawetz, Healthy Feet Podiatry. I was just telling the patient I was going to be really cheesy for this video. First, I'm going to put my glasses on. So,
Good move.
Now I can see. There we go. Okay, so we have an ingrown nail, and this patient is in construction and wears steel-toed boots, right?
Yes.
Okay. So steel-toed boots sometimes can actually obviously there's no give to the boot, so you have any pressure whatsoever pushing these toes together, it will exaggerate an ingrown nail. So you can see if I push this like that, you can see what we call the toe meat, the meat of the toe comes over the toe, and that toe meat gets really angry. And nobody wants angry toe meat, do they?
Nope.
No.
Painful.
It's painful, yeah.
Painful.
Yeah, and then when you're standing 12 hours a day, you said?
Yes.
12 hours a day, angry toe meat, that combination doesn't work well, because what happens is eventually it gets angrier and then becomes infected, and then you get pus. We were hoping for pus today, but it doesn't look like pus, but it is infected. So I wrote a prescription for an antibiotic. I use Augmentin 875 milligrams for a case like this because it's amoxicillin with clavulanic acid. Clavulanic acid helps with the amoxicillin bind better, I guess, with the bacteria and kill the bacteria. I think it's something like that. I'm not saying exactly the way it is, but that's because I haven't been in school and had my didactic training for 20-something years now, but it makes the amoxicillin stronger. So a lot of doctors tend to just prescribe amoxicillin, and that's not strong enough for these infections. It's better when you have a mixed infection to use amoxicillin with clavulanic acid. 10 days worth is more than enough. And this was actually redder. You can't see it because of the betadine on there. So now we've got him numbed up. Lidocaine with epi. We're going to put a tourniquet on him. And if you want me to lay your head back, let me know, okay?
Yep.
Okay. So this is exsanguinated. And what I'm doing is it squeezes the blood out of the toe and pushes it forward back up to the foot. So there's less bleeding, and when you have angry toe meat staring you in the face, you want to get all that blood out of there, because angry toe meat is swollen toe meat, and it will actually put pressure on what's in there, and it will bleed more. So the pressure from that makes it bleed a lot, and angry toe meat bleeds a lot too. It's angry in a lot of ways. It bleeds, it swells, and it gets full of pus a lot of times too, pus and drainage. So now we're gonna open this up, okay? And that's our angry toe meat, by the way. All right, let's go ahead and free this up. So we're gonna do both sides. This patient, by the way, is pretty young, very young. And he would be dealing with this forever. It would just get worse and worse. This is chronic. This is chronic swelling there. This is chronic too, from an ingrown nail, and that's what you see. And a lot of people don't know that that they could actually fix this. This is good that you're fixing it when you're young, because this will actually get bigger and bigger. So your big toe will get actually huge after 10 years of this. It gets really big. So at this point, when we do this procedure, after it's done, a year down the road, it's actually it actually may get skinnier. So you're gonna have a skinnier toe, which is great, huh?
Yeah.
You can do a before and after of your toe. You can actually do a infomercial for ingrown nail procedures about how your toe got skinnier. Those pictures where they show before and after, a person standing there, like after they've lost like 20 pounds, you can do your toe. Just standing, you can draw like 2 eyes, a nose, and a mouth right there with a smile there, and then one with a sad face. The before will have a sad face on it. Okay, let's get these out. All right, here we go. This is the bad side first. And we're gonna take this back. And I wanna do more than enough because he's got so much hypertrophic skin, which is also called toe meat. This hypertrophic skin is gonna move over that way. And you can see it just alone, doing this right now, you can see when that comes over, when that actually heals, it's gonna come over this way. That's where it's gonna end, which is good. And that swelling and the thickness and the hypertrophy will actually go down with time, because there won't be any nail causing it to be a problem. And you can see there's bleeding. That's from all the pressure from the hypertrophic tissue that's there. Do you guys like the word what do you think? Hypertrophic tissue or toe meat? What sounds better?
Toe meat.
I like toe meat too.
It's funner.
Toe meat just sounds cool.
It does.
Right? So my patient's gonna go back to work and he's gonna talk about his toe meat all day. Look at that. That is amazing. Can you see it up there? I don't know if you're able to see. See how much is under the skin?
Yeah.
Really amazing. And you can see that's very satisfying to see that come out. And we're gonna get this piece too. We'll make sure that everything's out of there. And very little bleeding right now, which is good. And it's also usually when there is a lot of toe meat, and you can see this is callus, by the way. Look at that. Check that out. Very little bleeding because I used some epinephrine in there. He's young, he's healthy, he's got excellent blood flow. He's got hair growing on the skin right over here, and that's indicative of good blood flow too. And that's why we don't worry about using epinephrine in the injection because he's not vascular compromised. So this is great. This is nice and clean over here. That's the worst side of the whole thing, okay? And this, like I told you, will go down in time. Now we're gonna get the other side. Let's just see. How bad is this side actually? And we're gonna turn, slowly pull. I wish we had a drum in here so we could have a drum roll.
That would be cool.
Can you do a drum roll up there?
Bang.
There we
There
go,
we go.
yes. And there it is, check this out. This is very cool. See how big, look at how big this piece is.
Yeah.
Amazing. It's not freaking you out, right?
No.
Okay, good, cool.
That side was bigger.
Yeah, it's cool. It doesn't matter how many of these I do. I just think it's very thrilling when you get that piece out. I don't know, there's something cool about that. It's like winning a prize. It's like those machines when you grab the little
claw,
animal out of it and the claw finally grabs a hold of it and you get it. Actually, that would be cool. We put a bunch of toenails in one of the machines. Or a bunch of toes just
Pick
sticking
your
up. Just have a
prize.
bunch of people sitting there and see if you can grab it. The little claw comes down and then it shuts and grabs the nail and see if you can grab the nail out.
That'd be a good
thing.
game.
You know what? I'm gonna do that. I'm gonna invent one of those things. All right, let's see. So this is, so that's out of there now. Okay, now we're going to put the chemical, sodium hydroxide. This is my favorite, better than phenol. Phenol, I think you get too much of a reaction. Phenol is another chemical that's used, but there's something called a phenol reaction. A lot of people seem to get it. They react, it gets very angry, red, drains a lot, swells a lot after you use the phenol. And with the sodium hydroxide, you don't get as many people that react to it. So I personally think it's a better chemical to use to kill the nail matrix. Also, it's a 10-second stick. I think the phenol you have to use a little bit longer than 10 seconds too. So it's good for this. And this is just, people just do better overall with this. Is anyone using phenol in the office?
No.
Okay. So when we were in school, we used to use phenol a lot. It was another chemical, so. Anyway, all right, there's 2 sticks. We're gonna do number 3 here. It's 3 sticks, 10 seconds each. And I do see a little bit of skin there that I'm gonna take off of there. I'm looking for, yep, I see my tissue nipper. You're getting in there, you're getting real close, Alexia, good.
Yep.
Alexia is very good at this. She gets very close. She gets right in there, right up in there. She knows what to film. Okay, let me just see if I can get that little, I don't know why that piece is bugging me. There we go. It's out. Now one more side to do here. This side's bleeding a little bit more. And the thing we worry about when we see a little bit of bleeding is the chemical not taken. So what happens is the chemical will get diluted by the blood. That's why you don't want bleeding with these. And that's why a lot of people will comment on these, hey, there was a lot of bleeding during the procedure. Aren't you worried that you'll get regrowth? And I personally think they're right on that. That's how I was trained, that, the phenol or phenol or sodium hydroxide will get diluted by blood. And if you dilute the chemical, then it's not going to burn the nail matrix, which is where the nails grow from. And you're going to get regrowth. And back in the day, way back when I saw a lot of people using phenol and they weren't using tourniquets, there was a particular doctor, I'd get a lot of his patients where everyone would tell me they had a permanent procedure, but he'd get regrowth. And they would tell me that they couldn't believe how much it bled during the procedure too. So I'm guessing that the reason they got the regrowth was because of the the dilution of the chemical. So we got one more to go. And I can see actually with this, the good thing is when you do it, when you're putting this chemical there, you can actually see it burning it. And I'm gonna have Alexia zoom in on this a little bit too. But you can see, if you can see inside of there, it's got like a grayish, brownish tint, right? There, and that's where, that's the chemical burn. That's how you know it's actually burning it. And that's the key thing right there, is to burn it. And I'll take this out in 1 second here and you can see the color of it. Can you see that up close, Alexia? Do you see that? Okay. Let me dry this, and then let me get this overhanging piece of skin off of there too. Just so we can see it better, and also because that's could be a problem when it heals. There we go. Okay. So look right inside of there. You can see let me look there. Yeah.
Yep.
And that's how you can tell that it burned it. So that looks good. Very good. All of this will heal. Get close again. Look at this. This is what happens. This will move over this way. Toe meat and everything. The toe meat will decrease in size, and you'll get unswollen toe meat. So it'll look like that. It'll look great. I mean, this is what it's going to look like when it's finally healed, probably 4 weeks from now. And then your boots obviously are going to push that too. So that's it. That's the whole procedure. You don't need to see the wrapping. It's kind of boring anyway. What I'm going to do is just wrap it like that and put some stuff on it. You know, the whole thing. So if you like what you see, subscribe to the channel. We have awesome videos on here. Scroll down. It's not just ingrown nails. There's surgeries on there, ankle fractures. We've got plantar fasciitis treatments on there, plantar fasciitis surgery. There's a lot more videos than just the ingrown. So check it out. Check out the channel. And we'll see you for the next video. Thanks.